Welcome to A Course to Retirement with Grand Rapids Certified Financial Planner Ron Corser. Ron Corser and Associates are planning today for the potential of tomorrow.
And welcome into the program. This is your Course to Retirement. Grand Rapids, your resource for a common sense approach to planning for your financial, investment, and retirement future. And normally we focus on the wealth. Today we're going to focus on the health. We've got Nancy Corser along with us. Nancy, it's been a while. Welcome back to the show.
Thank you very much. Welcome to be back.
It's a pleasure to have you. And just to give a little bit of background, that's kind of right. Ron, your husband, the founder of the firm, is a CFP. He really does focus on the wealth, on the money, on the financial planning. But of course, to support the financial planning and maybe what's more important is the health planning. And that's really your bailiwick in the area that you focus on, correct?
Correct. I've been working with my husband, Ron, now for a little over 15 years, and it became abundantly clear that when he was working with his clients, many of them at age 64 were starting to say, Ron, will you help me with my Medicare? And instead of saying, sure, he said, guess what? My wife can help you with this. So before you knew it, it became my area of expertise. So that's my area of expertise, as I said, in helping people who are turning 65 are first eligible or also during open enrollment, which is this time of the year at the present.
Now, I had a question about that because we were chatting just briefly before the program. There's really sort of two different times that we need to focus on. One is when we first have the opportunity to enroll, and then on an ongoing basis thereafter, it's kind of that open enrollment period where we've got the opportunity that if we need to, we can make any kind of changes to our plan, correct?
Correct. And actually, I'm going to take the second topic area there, which is open enrollment. And it's particularly dear to my heart right now because we are off and running. And open enrollment for anyone already in Medicare started on October 1st, which was last week. And officially on the 15th, we are able to meet with people and start to make plan changes. What's important to know about open enrollment, it is generally for most people the only time of the year that they can take a review of their plan. And again, if they want to make changes, now is that window. And that window is the 15th of October through the 7th of December, which is about a 7-week period of time. So it's a particularly busy time of the year for us. And one of the things that we always promise is the opportunity to review. And it's this one time of the year where we meet with our clients if they so desire.
Well, I want to first give the phone number that if you would like to review or talk over any considerations with Medicare or your health coverage for retirement and beyond, long-term care, a consideration obviously as well, pick up the phone, give a call to Grand Rapids Resource Certified Financial Planner, Ron Corser, with us talking about the wealth side of planning. Wife Nancy Corser here talking about the health side of planning. But either side of that you have concerns about, they are willing to sit down with you, have a complimentary discussion, a review, a consultation. 616-301-2581 is the number to call. 616-301-2581, 616-301-2581. And so as we are getting into this, what I'm sure is a fast-moving 7-week period, this is the opportunity to improve coverage or maybe look at pricing and cost. Why would somebody particularly want to pay attention and maybe be proactive in that open enrollment period, Nancy?
Well, we have an opportunity to look at Medicare Advantage plans as well as prescription drug plans. So if we look at the Medicare Advantage plan, someone may want to revisit their plan from a pricing perspective because all the plans will have some type of premium, although some are actually zero. And in addition to that, we look at the maximum out of pocket, which often will change from year to year. It's an opportunity to review your doctors, making sure that they're in the network. And then many of the plans will have embedded services that may also change. So we might have change in the dental or the vision or the hearing. And there are even over-the-counter benefits that are available in many plans today. So again, it's an opportunity to evaluate what your plan is today and then see what changes have been made. Now, the plan providers have all sent out to everyone in Medicare what's called an annual notice of change document. So we always ask folks to take a look at that first, review the changes, see if it makes sense, if they have questions, and if they see that there have been changes that are unacceptable or aren't going to work for them, that's definitely the time to pick up the phone and ask us for some help.
Now, Nancy, I get it, but sometimes those forms look like legalese and they're full of language that I open up certain statements or documents, especially involving health insurance, unfortunately. And it's Greek to me. Can you help translate what those changes are? If somebody's got that document and maybe needs to have that review or uncover if those changes are acceptable or appropriate for their situation?
Certainly. And what we do is we often will schedule either a phone appointment or we'll have them come into the office. And we are still adhering to all of the COVID-19 guidelines. But regardless, we'll touch base with them to prepare for that appointment in advance and inquire of their doctors and their medications and so on. And then we work with an agenda or an opportunity to review item by item. But the name of my program from the very beginning has been Medicare Made Simple. And that really is my goal, is to take a complicated topic, or like you say, even just looking at all the many changes and breaking them down into a manageable, understandable level, so that you know that your doctor might be a visit of $5 or your specialist might be $45. So we do take something fairly complicated and break it down into what we believe is more manageable and understandable. So you can make a good decision.
And these decisions in many ways have lifelong implications, or certainly at least for the next year will determine a lot of your cost and pricing for your healthcare. So certainly worth the time, I think, to sit down once a year and look at these important choices and decisions that you have. And again, if you'd like a qualified, experienced professional to help you along with that, Nancy Corser, part of the team there at Ron Corser and Associates, pick up the phone and give a call, 616-301-2581, 616-301-2581. Now, Nancy, you brought along a list here of 11 costly Medicare mistakes that you should avoid making. You give a little background here, and it starts that Medicare covers the bulk of your healthcare related expenses after you turn 65. But the core Medicare plan alone won't cover everything. And that's why we a lot of times have these discussions about supplemental plans and advantage plans and Part D, because those cover additional aspects or elements of your total healthcare costs, correct?
Correct. So everyone in Medicare starts out with Part A and Part B, and that's referred to as Original Medicare. And that program was put in place in 1965. And when you look at those parts of the plan, you will find that Medicare Part A has a zero premium as long as you've worked 10 years or more, but it has a lot of out-of-pocket expense. In fact, the Part A deductible this year is over $1,400. So that begins to paint the picture of what can I do to minimize my risk in the event that I was to be admitted into the hospital. And that's where the other plans, often referred to as supplemental, will start to plug those holes or those gaps. Then we also have Part B, and in general, Part B, Medicare pays 80% of whatever that Medicare allowed amount is, and the insured pays 20%. So again, when you go through the parts A and B, you will see that there is a lot of out-of-pocket expense. And there also is a Part B premium that everyone must pay. And right now it's $144.60, and that's the base premium. They have not yet announced the new premium for next year. I'm doubtful that it would be anything at all, and if it is, it's going to be very minimal, given especially this past year. But if you just go with Original Medicare, Part A and B, you are also expected to sign up for Part D, which is the prescription drug coverage. And if you do not at the time that you're first eligible or turning 65, there is a permanent penalty that will be assessed. But as you said, I always start out with original Medicare to lay that foundation of, if you do nothing, this is what it's going to look like. But if you want to do something above and beyond that, there's actually two approaches. One is an approach where we look at original Medicare plus a Medigap supplement plus a prescription drug plan. The other approach is to look at a Medicare Advantage plan. It's often referred to as Part C, A, B, C, D. That's all the Medicare lingo there. And the Advantage plans take all the parts and pieces of A and B, and they become Part C. You still have to pay your Part B premium. Sometimes people will inquire of that. And again, it will take some of the out-of-pocket expense, and it will treat it differently, meaning that if you're in a Medigap, it's virtually going to pay for all the out-of-pocket expense. But if you have a Medicare Advantage plan, depending upon what you pay in premium, it is going to begin to reduce some of your out-of-pocket expense in exchange for a premium.
Well, we know when you look at those healthcare bills, hospital bills, 20% of one of those bills can be a pretty substantial amount of money. So we want to make sure that we're covering things and that we know what our maximum potential expense will be, and that we've got it saved or budgeted for somewhere. We've got access to the maximum incurrence that we could experience. So again, carefully look through all of these options and have a guide, a qualified, experienced professional walk through those steps along with you. Certainly can be beneficial in knowing and understanding what your ongoing costs are going to be, even with healthy routine maintenance, or if there is some type of event, what that maximum potential expense will be. Important decisions here, ladies and gentlemen. And Nancy Courser is that resource for you, Grand Rapids, surrounding areas. If you're reaching that age 65, or it is annual enrollment season, open enrollment, we've got a limited period of time for you to maybe evaluate those options and see if there's a cost savings method that you could be looking at, or if you could expand coverage for the same potential cost. 616-301-2581, the number to call, 616-301-2581, 616-301-2581. Now, Nancy, as somebody's guide, are you able to sort of walk them through the process and show them all of those options? Here's one combination of plan letters and options compared to another, and here's maybe what's best for you this year versus what might be best for you 2 or 3 years from now. Because I know at the initial enrollment, age 65, there's kind of no pre-qualifications or medical underwriting, whereas if we do want to change plans down the road, at that time they can require some medical underwriting, if I'm not mistaken. Is that correct?
That's correct. Let me also mention that in terms of being able to compare plans during this open enrollment, I am an independent agent. So that's important to note, because I can compare more than one carrier's plan. We can look at all the carriers in the Western Michigan area. I'm licensed in the entire state of Michigan, so that's predominantly where I will help people. But as far as the plans themselves, there are probably about 29 different Medicare Advantage plans this year, and I have the vast majority of them. So in being able to compare plans that we can, one of the deciding factors generally is the doctor, that the person wants to stay with that particular physician. So that begins to kind of rule out the plan possibilities. But in the event the physician participates in several plans, then again, I'm going to drill a little bit further and find out more about what their concerns are for coverage. Is it that they might be hospitalized this year? Is it that they go to specialists on a regular basis? Is it that they anticipate physical therapy? Because all of this has an out-of-pocket potential expense. So I'm going to ask a number of questions, which will help guide us to several different plans, or it may be one particular carrier who has multiple plans, but there's something about that plan that really makes sense to that individual. Now, you had talked about also this whole concept of underwriting and guarantee issue. That really pertains to the Medigap only. Okay. And what we're saying there is, if you are turning 65 or you're first eligible, you have the opportunity to come on within 6 months of your Part B effective date and pick any Medigap carrier that you so desire. After that, it is about the medical underwriting. And it's as simple as answering some questions and talking to an underwriter. It's nothing invasive. They're not coming into your home. There's no physical exam, but it's being honest on the application and being able to answer the questions in a certain way. When it comes to the Medicare Advantage plan, there no longer are any disqualifiers. In 2021, they will accept anyone that has had kidney failure or renal failure. In the past, that had been set aside as a different group, if you will. But this year, with Advantage plan holders, as long as you're eligible for Medicare and you make a decision to come aboard during open enrollment or when you're eligible, you can pick any plan. Doesn't matter about your health, about your prior history, nothing. It's all good to go.
That's good news. Open to more people with obviously the need.
And the other big change that they made this year, which for some folks is very important, and that is insulin this year on some of the Medicare Advantage plans is going to have a much lower copay than what it's had in the past.
Fantastic.
So I've seen some of the plans that have been $25 a month for a copay or $35 a month, and it's not going to count towards the donut hole or the coverage gap, and it really is going to make a big, big difference. And that was something that the current administration had worked on in terms of starting to make a dent on some of those medications. And one this year is definitely the medications associated with diabetes.
For our initial enrollment, age 65, sort of a question about that. If I am still working, because not everybody intends to retire right at 65, I know it is a kind of an earmark milestone for a lot of people. Oh, I'm eligible for Medicare, so that must mean that I'm ready to retire. But many people don't retire at 65. If I am still continuing to work and am covered by an employer workplace healthcare plan, do the same rules apply there? Do I still need to enroll in Medicare?
So the rules are somewhat different, but we always stress that when you are getting ready to turn 65, generally about 3 to 4 months in advance, maybe 6, that you start evaluating whether you need to come aboard or not. Now, a couple things come into play. Someone who has a group plan and there are 20 or more employees on their group plan and are actively working and think that their group plan is just fine, they technically don't need to do anything at all. They can stay right on their group plan. It's probably a good idea to double check with their HR department just to make sure that as long as they are an active employee that they can continue to do that.
So I'm sorry, Dan, but your employer size matters? The
Yes.
size of the company? Huh.
The size of the plan with the number of insured on the plan. So it has to be 20 insured employees on the plan or more.
So even if there was a company with 50 people, which sounds like it would meet that, but if only 19 of them are insured and on the plan, so this is something you actually might have to check with your HR representative about.
It is. Like. And I have had people that have done that and it has come back 18 or 19. And when that happens, yes, they are required to sign up for Part A and Part B. And then they need to decide what they want to do with their group plan. And most people at that point will drop their group plan and come aboard Part A and B and then add supplemental insurance to that.
So lots of details that we need to work out and figure out. And again, if you've got questions about this open enrollment period or the initial onboarding for Medicare A, B, do I need C? Is the Advantage plan better? Certainly, we want to probably include D in there. Lots of different lingo there, and it gets even more complex after that. Certainly beneficial to have an experienced professional walking along with you. Give Nancy Corser a call at Ron Corser and Associates, 616-301-2581, 616-301-2581. You mentioned a couple terms. One of them I liked. You said donut hole. That sounded good, but then you said coverage gap, and that sounded not as appealing as donut holes.
Right. I wish we could do something with those donut holes. I think a lot of people that find themselves in what is also called the coverage gap, they're one and the same. It kind of got that lingo. Back in 2006, when somebody spent a certain amount of money on their medications and found themselves into an arena or a hole or a gap where literally there was no coverage. So back in 2006, when they introduced this program, which is a bit complicated in terms of paying a premium and often an annual deductible, and then they keep track of how much you've actually spent in your medication cost, that a person might have found themselves in the arena of having to pay entirely for their medication. The good news is over the last 14 years, the drug companies as well as Medicare have started to close the gap, but it will never go away unless they go back and they completely take it away. But the lowest it is planning to go right now is 25%. So if your medication cost was $100 and you only paid $10, but you found yourself in the coverage gap after spending X number of dollars, you might pay $25 for that medication instead of the $10 copay.
But I've heard horror stories, Nancy, of people with certain conditions or afflictions that their medication is $1,000 around or multiple thousands of dollars a month for particular medications. Is the same scale going to be used for those kind of medications?
It is. In the coverage gap, 25% is applied to the retail price. And then there is one more threshold beyond that. And keep in mind that if you are someone who has these very expensive medications, that you do receive a summary report every month, and it shows you exactly where you are in relationship to the coverage gap. There's one more level, and that's referred to as the catastrophic level. So if a person finds themselves spending even more money, and again, there's criteria that's used to find themselves in that category, then they will pay less. It's generally 5% of the cost of the drug, or I think it's $2 and some odd cents for the tier 1 or the tier 2, or we've got like $7 or $8 for the brand name drug. But they do differentiate between tier 1 and 2, which is generic, and tier 3 and 4, which tends to be a brand name drug.
Well,
yes.
Again, if we've got certain medications that we know we're going to be on, that's one of the reasons why this open enrollment period is so critical for people to look at those options, because it could be priced differently from one plan to the next, correct?
Yes, it could be priced from one plan to the next. The tiers could have changed. The medication might have been eliminated altogether from the formulary. So part of our analysis during open enrollment is there is a good government tool. It is called Medicare.gov, and they do have a plan finder. We use that same tool, and for anyone that wants an opportunity to learn how to use it, we will show them. In addition to that, last year, the government said, as a Medicare enrollee, they could sign up on mymedicare.gov, and they can set up a password and a sign-on, and we can retrieve the medications right from the website. They're housed right out there, and then we can run the analysis right from there. And the tool itself will make a recommendation. Can be a little bit tricky, and that again is why talking to someone who is an expert, who knows a little bit more about what you should look for and how to actually analyze the medications and make those kinds of changes so that you can make a good decision. So I was also going to mention, I have a website, and my website is nancycourser.com, and you can actually submit a request right through my website. There is a tab that says, it talks about a consultation as well as providing these medications and letting me know what pharmacy that you go to. And then we can do the analysis right from there. But we do have a website that will also assist as well.
Well, again, the dynamic duo here, Ron Courser, CFP, helping you with the wealth, Nancy Courser, helping you with the health care aspects of your planning. You can go to nancycourser.com, you can go to roncourser.com, or again, the conversation is complimentary, free of charge, to have the help, the assistance of a qualified, experienced professional. 616-301-2581, 616-301-2581, 616-301-2581. And Nancy, I got to imagine that if we can do the right thing, take the right steps on the health side, it ends up meaning that your husband, Ron, has a little easier job with the wealth management side. And we probably have more there to allow him to help us manage.
Absolutely. They really do go hand in hand, especially when you have retired and you're no longer working. So you're working with the income plan that Ron has put together for you. You want to make sure that if you go the Medicare Advantage plan, you pretty much pay as you go, but the safeguard is the maximum out of pocket. So as you referred earlier, you might have a maximum out of pocket of $5,000 for the year. And you know that, okay, worst possible outcome is that's the level I need to be able to come up with $5,000 over the course of a year. And it takes a lot of medical issues to be able to accumulate that kind of money, but that would be the cap, that would be the threshold. And sometimes people look at the Medigap, which is the other approach, and they can budget accordingly by paying a premium that's more. Yes, they have more coverage, but they also don't have the pay-as-you-go feature. So you can kind of get your arms around what your overall costs are by understanding the plans and how the two different plans work.
Well, Nancy, you brought along this great list of 11 costly Medicare mistakes, and we haven't scratched the surface on that. So when we come back after the break, let's dive into this list, because I'm sure that there are people out there listening that potentially could be making some of these costly mistakes, and we want to identify them and avoid them. So anything from keeping your Medicare Part D plan on autopilot, buying the same Medicare Part D plan as your spouse, going out of network for your Medicare Advantage plan. We'll talk about those and more, why they're mistakes, when we come back here with Nancy Courser on Your Course to Retirement. In the meantime, again, if you'd like to have a conversation about your health or your wealth, pick up the phone and give Grand Rapids Resource a call there at Ron Courser and Associates. 616-301-2581, 616-301-2581. You can go to roncourser.com. Specific healthcare, Medicare questions, go to nancycourser.com. Tools, calculators, resources, all available there on the websites. 616-301-2581 to speak directly with the team and your local professional resources. 616-301-2581. Quick break. We'll be back, and we'll dive into those 11 mistakes to avoid with Medicare. And we are back. Once again, Nancy Courser, our guest today on Your Course to Retirement, really running the show there at Ron Courser and Associates, I have a feeling. But she is dealing with the health side of things. Husband, Ron Courser, our normal resource here, does the wealth planning and management. He's a certified financial planner. Nancy specializes in helping people with the healthcare side. Medicare, of course, of particular concern. Once we hit age 65 and beyond, probably the bulk of our healthcare expenses covered through Medicare, but we've got to sign up for the right coverage. And if you've got any questions or concerns, we are right now in that open enrollment period. It's a short window where you can consider making any changes. Give Nancy a call. She's willing to walk through that with you, analyze your current plan and setup, and just make sure that you are doing the right things for your coverage, for your expenses. 616-301-2581, 616-301-2581. Now, Nancy, you did have the list of the 11 costly Medicare mistakes that you should avoid making. Number one on the list, keeping Medicare Part D on autopilot. So this is where we just roll over and we ignore this open enrollment season, I believe.
That's right. And there are many a person that does that, and that's very dangerous. I'm not necessarily suggesting every year you look at your plan, but certainly take a look at the annual notice of change document, which has been mailed. And some of the plans we noted this year had drastic changes when it came to the premium. So we are actually contacting our clients and making them aware of that so that we can visit their plan during this period of time. But many people will automatically assume that if the plan worked in the past, that it will continue to work in the future. And if you wait too long and it's January and then you uncover that the tier 1 medication is now in a tier 2, you have no opportunity to make the change. So it's a good idea to take a look at it. I've also had people that have been in the same plan since day one, And I think sometimes there's a reluctance or maybe even kind of a fear factor that says, well, it still works. Why would it really matter? Well, I think what really matters is those premiums can climb. I mean, I have seen plans that started out at $20 or $30 a month, and now they're well into $80 and $90 a month. And if you only take a couple of medications and they're generic, there really is not generally a need to be in a plan that is that expensive. Most of the lower price plans, the average premium is probably in the neighborhood of about $32, $33 a month. And anything less than that, if somebody takes generics, maybe a few brand, we can generally find them a plan in that price range. And then people that have more brand related medications or newly introduced medications for which there is no generic, they tend to be a little higher price plan.
I think that that's important because to some extent, people might say to themselves, well, I'll talk to my doctor and find the right medication that falls under the plan. But in certain circumstances, medications might not have alternatives. There might not be generics available for certain medications. And therefore, if we have one that did make that change from a tier 1 to a tier 2, and we didn't open that resource and fully educate ourselves on that change, we could be paying significantly more for the same medication.
Absolutely. Absolutely. And especially new ones too, like I say, that have been introduced. I've had a few people say, I'm looking at taking this, and when we look it up, it's not on the formulary, or it's $300-400, and then they do want to go back to their doctor and either find an alternative, or maybe in a year or two, it will be priced and on the formulary as well.
Mistake number 2, Nancy, picking the same Medicare Part D plan as your spouse. And right. Ron talks all the time about just because it's good for your neighbor doesn't mean it's good for you. This might be the pinnacle example. We could be in the same household under the same roof, and people's plans need to be different.
Correct. If you take any medications, generally speaking, the husband and wife don't take the same meds. In fact, Ron is a good example because we don't take the same medications. So when I look at doing an analysis for Ron versus myself, and I must say I came aboard Medicare this year, so I'm even that much more skilled in this arena. Our plans are not the same because our medication list is entirely different. Now, we both love the same pharmacy, so we make sure that that's intact. But beyond that, it doesn't make sense because I would end up paying more or less, depending upon how the scenario plays out here, by saying I want to be in the very same plan as Ron. Once in a while, for a husband and wife, maybe who don't take any medications, sure, you can be in the same plan. That makes perfect sense. But unless you take the same medications, it isn't something that you should automatically assume.
Well, this is something that for those under 65 with like a family health care plan or even an employer-sponsored health care plan that we're bringing on our family and get family coverage, we're not really picking and choosing something different for myself and my wife or my spouse or my children. It's kind of all part and parcel of the same plan. But now once we get to 65, the way that these different plans, part A, B, and D, are segmented out, there's really a whole lot more choice and variations that we need to pick as individuals, not as a household or a family.
Very true. And again, there's probably 30 different plans this year, with the lowest premium being $6 and some odd cents, and the highest one being right out there with $100. So it really is very personalized, very customized as to that person's specific medication needs. Now, and I'll also mention, because this is a common question, is people will say, well, here are the medications I take today, but what if they change next week or next month? I would tell you that the government says, in terms of the formularies that are used, every Part D plan must have medications to treat every possible medical condition. So whether it's high blood pressure, high cholesterol, it's gout, vertigo, the list goes on, so on and so forth. There are medications out there.
But people who have been on medications know that certain medications can work for them without side effects versus another medication that might cause side effects. So those different plans, just because it has a medication doesn't mean it's the right medication for me.
That is very true. And once in a while, we will find a particular medication that might be a little more unique, will only appear on one particular plan, and that's the one that we have to zero in on. So again, when people provide us the medications, they have to be very specific. We want to know the name. If a person cannot take a generic, we need to know that, because that makes a difference in terms of how the plan will actually look at that. And then the quantity and the frequency, I mean, it gets very detailed.
You mentioned the range in pricing from $6 a month to about $100 a month. Does anybody just say, well, the $100 a month, that's the Cadillac plan, that's the gold plan, give me that one because I know everything that I'm going to need is covered? Is that the way it works?
No, it doesn't. And again, sometimes I will see folks that have left it in Autopilot, and that might have even been the thinking when they bought the plan. But that doesn't mean that's the best plan for them. Again, a lot of times the more expensive plans are those that have the higher price medications, the more unique, the more specialized medications. The other thing that we didn't mention so far is every plan participates with certain pharmacies, and there is a pharmacy distinction between a preferred pharmacy, a standard pharmacy, and you're always going to pay a little more there. And there are some plans that have no pharmacy associated with them. So you're completely on your own. Should you pick a plan, go to a pharmacy that's not part of their network at all. So very important. So when you even ask me about the $100, Cadillac, is that possible? Well, that $100 Cadillac plan, you might end up finding yourself going to the wrong pharmacy. And again, knowing and having somebody point out all of those things to you, you can zero in on the right plan for you.
So not just about your health. This is about your habits, about your preferences, about your lifestyle, where you like to travel. Are you willing to go all the way across town for that other pharmacy, or do you want the one right on the corner that you've been going to for years and years?
Exactly. And if you do travel, you want to make sure that your network allows for nationwide pharmacies.
Number 3 on your list here, going out of network in your Medicare Advantage plan, another mistake to avoid.
Another mistake to avoid, whether it's in reference to the pharmacy side of things in terms of medications, or even in terms of doctors or specialists or medical procedures that may have already been scheduled. So we're not talking about emergency or urgent care, but there is an in-network condition or an out-of-network condition. And you want to make sure, if at all possible, that when you're scheduling your day-to-day kinds of doctor's appointments, that you stay in the network. Again, if it's an emergency or urgent care, that isn't what we're talking about, because you're going to be covered at the same in-network price. But making sure that your doctor participates in the plan, making sure your medication is at the pharmacy that you wish to choose, because otherwise it's generally going to cost you more, or you might find you don't have any coverage at all.
Well, again, if you need help, assistance with this, we are talking with Nancy Courser, Grand Rapids savers, investors, those reaching 65 or beyond, anyone with healthcare related issues, questions, concerns, those on Medicare or looking to protect against more significant future potential medical expenses with the cost of long-term care as an astronomical potential expense. We want to plan and protect against that as well. Nancy Courser, your resource, and willing to have that conversation with you on a complimentary, free of cost, no charge basis. Give a call, 616-301-2581, 616-301-2581. This next one, mistake to avoid, not switching Medicare Advantage plans mid-year if needed. So I want to make sure it's to avoid not switching plans. So if needed, we should switch plans mid-year is what this is saying?
Well, it's actually saying a couple things here. And I guess the first thing I'm going to point out is, with a Medicare Advantage plan, it is based on where you live. So the plans are designed based on the county that you live in, and they are priced accordingly. So you might have a plan in the Kent County area that has one premium, But as we go further north, that same plan might be more expensive because the cost of care is actually a bit more expensive. Now, with Medicare, there is something called a special election period. So if somebody does move out of that plan area, they are going to have to change plans. So that could be an example of making a change during the year outside of open enrollment, where in moving from one county to another would require a new plan, or moving outside the state of Michigan requires a completely new plan. And again, we will help with that. I've got a lot of folks that will go to Florida and they may decide to live there, or Arizona or Las Vegas or wherever the case may be. And if they're in a Medicare Advantage plan, they have 60 days with which to find a new plan, because their existing plan is not going to cover them in the new market that they are living in.
The high-tech connected world we are in today, just because you have a client moving to a different area does not mean that that you are not an accessible resource for them. You can still help and assist.
I can still help them. I have a business partner who is licensed in all 50 states. So when I get out, I'm licensed in Michigan and Florida. So when we leave those two states, then I call upon a partner that I've worked with for many years. I often will do the recommendation and the review, but then I will partner him up or her up with my go-to person, and they will take the ball from there and get them enrolled. And if they have any other questions, they can ask them at that time. The other thing that's being referred to here, and it's something that there will be notification on, is the following. Medicare does allow during the first couple of months of the year for someone in a Medicare Advantage plan to actually look at making a change. It's a lot like the open enrollment. And at this point, I would just say that there are some restrictions in terms of how it can be used. And as an agent, I don't do much with that particular time of the year, but Medicare will make that announcement that a change could be made in the event someone says at the end of the year, you know, I made a big mistake. That is not at all what I should have done with my Medicare Advantage plan. They're going to give them one more opportunity to make a change. I can help, but I cannot actually do much in the way of advertising that particular open enrollment type of window, but more to come on that.
A little bit of a do-over
a little bit of a do-over. That's right. I just can't advertise the do-over. If somebody came to me and said, I think I need to do a do-over for the following reason, I'm certainly here to help. Yes.
All right. Yes. Well, again, Nancy Courser, your resource, ladies and gentlemen. If you've got questions, concerns, we are in the open enrollment period now. Now is the time to make any changes and consider carefully what the consequences of your choices and elections are for the year to come and for all the years into the future. Nancy Courser can work through all of those, walk through the process of making that informed decision with you. 616-301-2581, 616-301-2581. Not picking the right Medigap plan. Now, Medigap is about that donut hole, correct?
No, actually not.
No, okay.
This shows how confusing that Medicare could actually be. So the Medigap plan is the alternative to the Medicare Advantage plan.
Okay.
The Medigap plan is a health insurance plan. It's going to cost more money because there's virtually no out-of-pocket expense. So in picking the right plan there, the emphasis is on when you first are eligible or first turning 65, that you have a 6-month window with which to come aboard with no medical questions. So in picking that particular plan, what people find today is, again, this is where it gets confusing, is there are different letters associated with the choice of a Medigap plan. So the plan letter today that is most in demand is plan letter G, as in green. And that particular plan letter starts at probably $100 and some a month, and it will provide virtually all the kind of coverage the person's looking for. The key here is if you wait too long and you're outside of the 6-month window from your Part B effective date, and you are now in the 7th month of your Part B effective date, and you find out that there's such a thing called a Medigap, and you say, okay, this is what I want, Nance, I have to tell you that you have to go through medical underwriting. So picking the right plan has really got to do with the timing of the plan. Yes, there are other plan letters that a person might be interested in. And those are, again, things that we can look at. There's Plan N and Plan G and Plan K and Plan C. But the most coverage today is being provided by Plan G, as in green.
Well, again, there's complex. I'm confused here, asking a few questions about that, but it's important to have that right guide, that right resource who can help to answer those questions, that can help lead you in the right direction, because there's going to be specific cost savings opportunities, even with what might seem like a little more money out of pocket today, if we meet certain criteria. I mean, bottom line, Nancy, this is insurance, correct? And insurance is always about covering for a much more catastrophic potential expense down the road. We just want to pay the least amount of possible to cover for that greatest potential cost.
Exactly. And again, when we sit down, we evaluate both options with the Medigap versus the Medicare Advantage plan. I always tell people too, if you are in a Medigap plan and you feel that it's a plan that is more than what you want to spend, maybe your health is so good, but you weren't sure when you initially signed up, it's very easy during open enrollment to move to a Medicare Advantage plan. What's not easy is to start with a Medicare Advantage plan and then look to go with a Medigap plan, because that's when the underwriting is actually involved. So it's understanding what your medical needs are, what they could be down the road. And then if you make a decision that one plan is better than the other, understanding what the timetables are and understanding that you may or may not have medical underwriting.
Well, that's always going to be an advantage, especially if we have had any kind of previous medical conditions or circumstances, but it's a limited time opportunity. We don't get that qualification of no underwriting forever. And that's why it's important. Because life happens, right? Certain medical circumstances, conditions can arise, especially as we get to a certain age where we're more prone to certain things. Our ability to qualify and get through that underwriting process may change over time. And so it's not always about our health condition today, but what it might be a few years down the road.
Absolutely. I think it is about future planning. I mean, I look at myself and my health history says, I think you need to look at this particular avenue of coverage. And I was more the kind of person that said, I want peace of mind in being able to know that when I laid my head down on the pillow, I knew exactly what I was going to pay per month without any unexpected out-of-pocket expenses. I didn't want to pay a copay to a doctor. I wanted to be able to pay it up front with my premium. The other thing with the Medigap is I get to pick the doctor I want to go see as long as they participate with Medicare. Whereas with an Advantage plan, works beautifully as long as you're good with the network. And again, living in Western Michigan, the networks are very expansive here. I mean, we have lots of good doctor choices in hospitals and so on. The other opportunity was for someone that travels. With the Medigap plan, you can go anywhere in the United States and your plan premium doesn't change, your out-of-pocket doesn't change, which is virtually none. Whereas with a Medicare Advantage plan, if I lived in Florida 6 months of the year, I might have to look at finding a doctor in Florida, and it would just take a little bit more effort. Doesn't necessarily mean it's going to cost me more, although it could. It's just, it requires a few more questions that have to be asked if I'm more of a traveler, if you will.
Well, again, Nancy Courser, your resource, ladies and gentlemen. Pick up the phone, give her a call, 616-301-2581, 616-301-2581. Now, Nancy, it's a mistake to overlook this opportunity. We've talked about that. That was one of the top mistakes to avoid. However, if everything is working correctly, is there necessarily any action that I have to take just to kind of reconfirm my choices and options?
No, it's very easy. In fact, if you review that annual notice of change, and many of my clients, that's exactly what they do, and they look at what the premium is, and they look at the changes that are anticipated to be made to the plan, they do nothing. They will automatically be renewed at the new plan rate and copays and so on and so forth. So it's very easy. You just take a look at it, either having someone look at it like me, you look at it and say, you know what, there's just not enough change here for me to really warrant wanting to sit down with somebody. I'm just fine the way that it is. And it automatically renews. Sometimes they issue a new Medicare, or they issue a new member ID card to represent the new year. And beyond that, you're good to go. And it all starts January 1st, 2021.
Not necessarily a bad thing then, so long as we're aware of any changes, have reviewed them, and make sure that we are okay with them.
Exactly. Yep. And
That
many of my
would make
clients,
for an easier open enrollment season for many. But unfortunately, changes are often made. And therefore, Nancy, I think that's why this is a busy time of year for you.
absolutely. And some people, they're new to Medicare and they don't remember exactly what they've done and why they've done it. So it's a nice refresher and a review of just some of the basics and how their plan is going to work. So we're here no matter what, whether you're first time in it or you've been in it for 10 or 12 years and your medications are something that you always want us to review, or you have a new doctor. There's a lot of doctors that have retired and maybe you want us to double check your doctor. Sometimes the pharmacies change, like I said, in reference to the prescription drug plans. Maybe you're thinking about moving and you're like, well, what do I do with our plan? There's just so many possibilities, and this is a good time of the year to be able to address those, especially if it requires a change.
Nancy, if we are turning or have turned 65 or that's coming, forgetting that it's time to sign up for Medicare, obviously another huge mistake to avoid.
Right. So every once in a while, there'll be somebody who doesn't do anything and they're not working, and maybe they're not even on any kind of health insurance program and they've been pretty healthy. What will happen is when they do need the resources of Medicare and those benefits, is they're going to find themselves paying a big penalty, as well as there's only certain times of the year that they can enroll, and it's called a general election period. And it generally is from January through March of every year. And then the plan doesn't even start until July of the subsequent year. So by just letting it completely fall beneath the cracks and ignoring it or forgetting about it or who knows what, it can be a very costly mistake.
Well, unfortunately, I don't think we're going to have time to get through all of these, so we might have to laundry list the last several. Or, ladies and gentlemen, if you would like this list of 11 mistakes to avoid with your Medicare coverage, pick up the phone and give Nancy Courser a call or visit online, nancycourser.com, 616-301-2581, 616-301-2581. Get through as many as we can here, though. If you have retiree or COBRA coverage, Nancy, it would be a mistake not signing up for Medicare Part B.
Correct. You want to go ahead, and there are 2 forms that generally are required from signing up for Part B when you're no longer 65. We help with that. One goes to the employer and the other one is what you fill out. And it's important you do it fairly soon after you have retired and you're no longer an active employee. If you're allowed and you take the COBRA, COBRA is not considered credible coverage, so you just need to be very aware of, again, this is where the timetables come in as to when you can do what, and if you wait too long, you're going to pay in one way or the other. So keeping in mind, sign up for Part B once you have retired, or Part A and B for some people.
Yeah, and that kind of rolls into number 8, forgetting about Medicare Part B enrollment deadlines after leaving your job. So I'm going to skip that one. Talk about 2 that your husband actually has touched on with us in recent weeks. The fact that your income actually directly impacts the premium payments that you will pay for Medicare. And so in the last several years of your working career, or in the couple years leading up to the age that you enroll in Medicare, you don't want to make any financial moves that will cause you to pay more on the Medicare premiums. It's kind of means tested.
It is. So what happens is when you get ready to come aboard, Medicare is going to look at your income tax records because they have access to the IRS side of things. And they're going to look 2 years back at your modified adjusted gross income. And there are tables that they will look at based on you being married or based on being single, and then look at those income thresholds. And if your income fits a certain category, if you will, you're going to pay more. So the base premium right now for a married couple, I think, is right in the neighborhood of about $178,000, $179,000. And for a single person, it's in the neighborhood of about $78,000 or $79,000. So having said that, they will look 2 years back. And if you have recently retired, they may be looking at a year that you were working and maybe you got a big bonus that year. But the reality is that the year prior, you may not have been working. They will actually allow you to revisit that. And
so
there is,
you can contest it. That's another one. You can
right. We'll roll that one right in there. We can contest it. Again, the Medicare and Medicaid, full of all different forms. This particular form will allow you to request an exception, and you fill it out. And right now, Social Security is still the one that does the enrollment for Medicare, as well as determines what the Part B premium is. They're still locked down. So they will make phone appointments and they will walk you through the process that way. Once they're open, you'll be able to get back in the office with that appeal, if you will, and say, okay, this is my income tax for last year. You can see that I am definitely not a higher income beneficiary. Will you please adjust it? And they're pretty good about doing that. Yes.
Well, these 11 tips, 11 mistakes to avoid with your Medicare, all important things that can save you significant amounts of money or give you significantly improved protection and benefits. So let's make sure that once a year we're at least dusting things off, reviewing them, making sure that we understand our coverage and the costs that are associated with it, enrolling when it's time to enroll. Let's not forget those key milestones as well. And if you need the help of a qualified, experienced professional, Nancy Courser is here for you. Grand Rapids area savers, investors, those retirement-minded individuals that are looking for answers to some of the most complex financial questions. Wealth or health, the dynamic duo, the team there at Ron Courser and Associates can help you out. Nancy, we always appreciate having you on the program. This is a great time of year for you to be here and join us. And thank you for answering so many of our questions about Medicare coverage and the open enrollment period.
Thank you, Peter.
Give them a call there at Ron Courser and Associates. Looking forward to helping and assisting. 616-301-2581. That's 616-301-2581. We'll talk to you again real soon.
Tune in to Ron Courser's full radio program, A Course to Retirement, Sunday mornings at 9 a.m. on WOOD, and visit roncourser.com for many valuable resources, including other great episodes of Your Course to Retirement.
The content of this radio show is provided for informational purposes only and is not a solicitation or recommendation of any investment strategy. You are encouraged to seek investment, tax, or legal advice from an independent professional advisor. Any investments and/or investment strategies mentioned involve risk, including the possible loss of principal. Advisory services offered through Brookstone Capital Management, a registered investment advisor. Annuity guarantees are based solely on the financial strength and claims-paying ability of the issuing company. Withdrawals of growth from annuities may be taxable as ordinary income in the year it is taken. Individuals should review contracts for specific details of the product's features and costs. Early withdrawals may subject the owner to penalties, fees, or taxes.
Fiduciary duty extends solely to investment advisory advice and does not extend to other activities such as insurance or broker-dealer services. Advisory clients are charged a quarterly fee for assets under management, while insurance products pay a commission, which may result in a conflict of interest regarding compensation.